So in 2011, Mike and I had a meeting with Bill Gates where he asked us what needs to happen to take this idea of value-based healthcare to scale. And my answer, and Mike agreed, was that outcome measurement needed to become the norm so that people could and would focus on improving value by improving health outcomes. So we agreed that there needed to be an international effort to make this transformation, that we needed some sort of consortium that was across countries.
I got involved in ICHOM because I think ICHOM is actually addressing the single most important question in healthcare, which is why we're in healthcare in the first place, which is to deliver outcomes that matter to patients. The healthcare system is not here to exist for its own benefit, to provide services or as an academic exercise or to just simply further the world of medicine. It's to serve the needs of patients who need help. And ICHOM's focus is on that question that's at the center of the mission of healthcare, delivering better outcomes for all patients.
I started working with Michael Porter, and not long afterwards met some of the other co-founders of ICHOM and thought, wow, this is a great opportunity to use this nonprofit to help scale and influence the adoption of value-based healthcare globally. So I was one of the original 3 members of the team that really was trying to accomplish that mission.
We need healthcare that achieves better outcomes for each and for all. High-value care is the way to achieve better health equity, and relationship-centered services. Attention to improving the health outcomes is critical not only for individuals and families, but to support the professionalism of clinicians.
To keep it simple, we need to move from a healthcare system that is currently focusing too much on volume of care to value of care. This will only be possible if we are focusing care in fewer places, if we make sure that the best and most talented people are working together in multidisciplinary teams, that they are focusing on the medical conditions that really matter to the patients, and that they are providing the full care cycle, and that we finally also reimburse, hospitals and doctors in private practice by the outcomes that they are providing to the patients rather than the number of cases they do or, let's say, the complexity of the surgery they deliver.
Our hospital system, like many hospital systems in America, are struggling financially. Rising labor costs and flat revenues means that we just don't have enough money to cover our costs. So I think you see there the tension, right? There's a stronger emphasis on technology-enabled access, particularly to ambulatory or outpatient services, and a move away from very expensive fixed assets in our hospitals. So what does that tell me about the future of healthcare? To me, the future of healthcare is much more closer to the patient in their home via a digital service or close to their home, and it's much more focused on helping them manage their health and their disease and avoiding the hospital if at all possible.
And I think ICHOM can play a role in building networks of like-minded people that exchange best practices and copy ideas from each other. I think that's how we can really change healthcare for the good.
ICHOM has tremendous assets in the standard measure sets it has developed and the community of clinicians using them. When it stays focused on helping people use and improve those measures, it offers a very distinctive and important service.
It's still a model where often we access services in centralized locations. Often the patient as the customer is really not driving the interaction. So there's a lot there, right, that needs to change. And much of what I think of as value-based healthcare is changing the model that measures success, right? If we measure success more from an outcomes perspective, more from an experience perspective, and we reduce regulation, we reduce the constraints on the system then those same types of innovations that have made our lives better in other industries can flourish in healthcare. And that's an exciting future.